Welcome to British Biomedicine Institute. Today I, Dr. Pramod Khatri, Medical Director of British Biomedicine Clinical Trials, is going to teach you a simple topic named as adverse drug reactions. So basically, ADR is a noxious change which is suspected to a particular type of drug, and basically they can occur at a normal dose in a population, and they may require treatment, or if we decrease the dose, the chances of ADR will decrease. And these are the basic cautions for the future use of the same drug. So ADE, adverse drug event, basically these are any untoward occurrence which may present during medical treatment, but they does not necessarily have a causal relationship with the treatment. The incidence of ADR are more at polypharmacy, in the elder patients, in children, patient with multiple disease, pregnant ladies, malnourished community, immunosuppressant drugs which are being used, or drug abusers or addicted. They can show ADR, adverse drug reactions, and they can develop immediately, or they can be, if a patient is taking prolonged medications, then these areas they can still develop, or if a person has stopped taking a particular medicine, again ADR can happen. So basically these adverse drug reactions, they can be graded based upon the severity, either it is minor, moderate, severe or lethal. So under your minor, basically there is no requirement of treatment or antidote, or prolongation of hospitalization is not required at all. Whereas for moderate, basically it can require a change in drug treatment. There can be for a specific treatment or prolonged hospitalization stay can be there. Whereas under your severe, basically these are potentially life-threatening, and they can cause permanent damage, or they can require intensive medical treatment. And under your lethal, basically they are directly or indirectly, they can contribute to the death of a subject. So basically the ADR, adverse drug reactions, they can be classified based upon A, B, C, D, E, F. A for augmented, B for bizarre, C for continuous, D for delayed, E for ending use, F for failure of efficacy. So broadly or commonly, the type A and type B, they are found, or we can say type A is known as predictable. Basically these are based upon the pharmacological properties, whereas type B, we can say non-predictable, and basically these are based upon immunological responses or genetic makeup of a person. Type A, augmented, basically these are based on the pharmacological properties of the drug, so it can be predicted. They are most common, and they account for 75% of ADRs, and basically these are dose related, and they can be prevented if we minimize the dose usage. Example, use of anticoagulants like warfarin and heparin, they can develop bleeding. Antihypertensive medicines like alpha-1 antagonist, they can lead to hypotension. Anti-diabetic medicines like your insulin, they can lead to hypoglycemia. So these all are type A or augmented adverse drug reactions. So these can be easily predictable. Type A augmented are easily predictable. Whereas type B or bizarre or unpredictables, basically they do not have a direct relationship to the dose of a drug or any pharmacological mechanism of action, and they develop based on the immunological reaction of a drug, like your allergic reactions or they can be a idiosyncratic reactions, or basically these are your genetic predispositions. So most serious clinical outcome is with higher mortality and morbidity, and they may require immediate withdrawal of the drug from the patient, and basically these are unpredictable. Whereas type C, we can say chronic or continuous use, these are mostly associated with cumulative or we can say long-term exposure. If a patient is taking medicine for the long time, then type C or chronic continuous use ADR can develop. For example, analgesic, if a patient is taking NSAIDs medicine, there can be the chances of developing interstitial nephritis, papillary sclerosis or necrosis can start. And these type C are basically predictable. Type D, they are delayed. Basically they manifest themselves with significant delay, like your teratogenicity, thalidomide or phocomelia. Basically these are the flipper-like forelimbs. There can be development of mutagenesis or carcinogenesis. Basically these type D delayed, they take long time to develop or to show your adverse drug reactions. Like your here example is tardive dyskinesia, which can be due to low levodopa Parkinson's disease treatment. Again, these are predictables. Whereas type E, or we can say end of use, basically these happen when a patient suddenly withdrew the drug, or we can say drug withdrawal syndromes or rebound phenomena can happen. For example, sudden withdrawal of long-term therapy of beta blockers can induce rebound tachycardia or hypertension. Again, these are predictable. So under the DAUP pharmacovigilance, basically it is a science and activity which is related to the detection, assessment, understanding and prevention of adverse effect or events or any other drug related problems. Basically the information generated is useful in educating doctors and other official regulations of drug use, and it play an important role in rational use of medicines, as it provide the basis for safety, assessing the safety of a medicine. And the various activities which are involved in the pharmacovigilance are post-marketing surveillance or other methods of ADR monitoring, such as voluntarily reporting of doctors' prescription event monitoring, dissemination of adverse drug reaction data through drug alert or medical letters or advisories which are sent to the doctors by pharmaceutical and regulatory agencies. If there is a change in the labeling of medications indicating the restriction in use or situatory warnings, precautions, and even withdrawal of the medicine. So UMC, Upasana Monitoring Center, is located in the Sweden, and it is basically an international collaborating center. And in India, National Center is located at Ghaziabad. Peripheral center at medical college levels and tertiary and above hospitals, they are available inside the India. And basically these reports, they are generated by doctors, paramedical staffs to peripheral centers, then to the national center, and then to the UMC, Upasana Monitoring Center, to the Sweden. There can be a compilation of data, analysis of data, causal association are basically confirmed, and the guidelines are basically issued regarding the safe use of medicine, or there can be a guideline for restricted use or withdrawal of medicine from the market also. So in order to prevent the adverse effect from a drug, basically we can avoid inappropriate use of medicines. Inappropriate drug administration or rational therapeutics like your dosage form, duration, route of administration, frequency and technique, they should be assessed before injecting a medicine or before injecting a infusion. We can ask for previous history of drug reactions and allergies. Always suspect adverse drug reactions when no symptoms arise after initiation of the treatment, like no new drug for new symptom. Ask for laboratory findings like your serum creatinine level, etc. Basically, these are categorized into side effects, secondary effects, toxic effects, intolerance, idiosyncrasy, allergies, photosensitivity, drug dependence, teratogenicity, drug withdrawal reactions, mutagenicity, carcinogenicity, and drug-induced disease or iatrogenic disorder or iatrogenicity. So basically, you should be aware of iatrogenic, idiosyncrasy, idiopathic, and intolerance type of adverse effects. The side effects are basically unwanted effects which are unavoidable due to pharmacodynamic effect, and they can occur at any therapeutic dose, and basically these are predictable. For example, benzodiazepine can lead to motor coordination. H1 antihistaminics, they can lead to sedation. An effect may be therapeutic in one context but side effects in another context. Depression of AV conduction is the desired effect of digoxin in atrial fibrillation, but in some cases it may not be undesirable when it is used in congestive heart failure. Constipation by codeine is side effect, but it can be used as a therapeutic effect in patients with loose motion. Secondary effect. Basically, these are the indirect consequences of primary action of a drug. For example, corticosteroids, they can weaken our host defense mechanism so that latent tuberculosis can get activated. Toxic effect, or we can say poisonous effect. It is the dose or a duration which make a poison. If there is a overdose or prolonged use of a medicine, again it can show toxic effects. These effects are basically predictable and they are dose related. They can affect your CNS, CVS, kidney, liver, lungs, skin, and bone marrow due to drug toxicity. Toxicity may result from extension of therapeutic effect itself. For example, complete AV block by digoxin or bleeding due to heparin use. Under the poisoning, basically it is a substance which endangers life by severely affecting one or more vital function of a body. We can use specific antidotes like your receptor antagonist or chelating agents or specific antibodies for few poison treatment. For other as well as for poisons which have a selective antagonist, general supportive and symptomatic treatment can be given. The measures are resuscitation and maintenance of vital function, can maintain the maintenance of ABC, body temperature and blood glucose. There can also be a termination of exposures like decontamination. We can prevent absorption of ingested poisons, and hastening elimination of poison by inducing diuresis or altering urine pH can also be beneficial sometimes. So under your intolerance, basically it is the appearance of characteristics toxic effect of a drug in an individual at therapeutic dose. It can indicate low threshold of a patient to the action of a drug. For example, only few doses of carbamazepine may cause ataxia in some patients. Again, these are unpredictable. Idiosyncrasy. Basically, it is a genetically determined abnormal reactivity to a chemical. The drug can interact with some unique features of individual not found in majority of subjects, or they can produce uncharacteristic reactions. For example, chloramphenicol produce non-dose related serious aplastic anemia in rare individuals. Barbiturate can cause excitement and mental confusion in some subjects. Again, these are unpredictable. Drug allergies. Basically, these are also known as drug hypersensitivity. It is a immunological mediated reaction which has been produced, which can produce stereotypic symptoms which are unrelated to the pharmacodynamic profile of a drug. It generally occur even at much smaller dose and have a different time course of onset and duration. Again, these are unpredictable. Allergic reactions occur only in a small proportion of a population which are exposed to a drug. And history of prior sensitization may or may not be evident. The drug or its metabolite act as antigen AG, or more commonly haptens, or we can say incomplete antigens, and they can induce production of antibodies or sensitized lymphocytes can be produced. There are basically two types of allergic reactions: humoral and cell mediated. Humoral are basically again redivided into three types: type A, anaphylactic reactions; type 2, cytolytic reactions; type 3, retarded or Arthus reactions. Whereas cell mediated are basically type 4, or we can say delayed hypersensitivity reactions. Under your photosensitivity, basically it can cause a cutaneous reaction which can resulting from a drug inducing sensitization of skin to UV radiations or UV exposure. The reactions can be of two types: phototoxic T to S. Drug or its metabolite, they can accumulate in the skin. They can absorb light and they can undergo photochemical reactions followed by photobiological reactions resulting in tissue damage, or we can say sunburn. Example: arrhythmia, edema, blistering, hyperpigmentation and desquamation. The shorter wavelength of 290 to 320 nanometer UVB are basically responsible for causing photosensitivity. Another type is photoallergic AL. Basically, drug and its metabolite, they can induce cell mediated immune response which on exposure to the light of longer wavelength 320 to 400 nanometer UVA, they can produce a papillary or eczematous contact dermatitis like picture. And the drugs can also be cause photoallergic reactions like your sulfonamide, sulfonylurea, griseofulvin, chloroquine, chloropromazine. Drug dependence. Basically, if a drug is used for personal satisfaction, it can cause to drug dependence. Higher priority than other basic needs, often in the face of non-health or non-risk of a health. So basically they can cause a physical dependence, and it can be an altered physiological state which is being produced by the repeated administration of a drug, which necessitate the continuous presence of drug to maintain physiological equilibrium. Discontinuation of drug can result in characteristics of like your withdrawal or abstinence syndrome. Drug producing physical dependence are, for example, are opioids, barbiturates, and other depressant including alcohol and benzodiazepines. These medicines, these drugs, they can, like your opioid, barbiturate, and alcohol, benzodiazepines, they can lead to drug dependence symptom. Drug abuse, basically it can be referred to as use of a drug by self-medication in a manner or the amount which can deviate from approved medical and social pattern in a given culture at a given time. Whereas drug addiction is basically a pattern of compulsive drug use which has been characterized by overwhelming involvement with the use of a drug. Procuring the drug and using it take precedence over other activities. Under your drug habituation, or we can say it can show a psychological dependence. It denotes less intensive involvement of a drug so that its withdrawal produce only mild discomfort. Consumption of tea, coffee, tobacco, social drinking are regarding habituating or physical dependence is basically absent here. There can be drug withdrawal reactions if there is a sudden interruption of a therapy with certain other drugs which can result in adverse consequences, mostly in the form of a worsening of clinical condition for which the drug was being used. For example, acute adrenal insufficiency must be precipitated by abrupt cessation of corticosteroid therapies. Teratogenicity, or we can say teratos or monsters. Basically, these drugs, they can cause fetal abnormalities when they are administered to a pregnant lady. Drug can affect the fetus in 3 different stages. Fertilization and implantation, basically from conception to 17 days, there can be a failure of pregnancy which often goes unnoticed. If it is between 18 to 55 days of gestation, then it can lead to organogenesis. Basically, their deformity will start coming in and there will be deformed organ development. And if it is more than 56 days, then there will be a delay in the growth and development, and there can be an abnormal functionality or development can occur. For example, if a pregnant lady is taking or consuming ACE inhibitor, thalidomides, warfarin, barbiturates, then these medicines, they can cause teratogenicity. There can be an abnormal birth defect. Under your mutagenicity or carcinogenicity, basically they can cause genetic defect and cancer respectively. They can have a reactive intermediates which affect gene, and they may cause structural change in the chromosome. Even without interacting directly with the DNA, certain chemical can promote malignant change in genetically damaged cell which can result in formation of a carcinogenesis. For example, anti-cancer drugs, radioisotopes, estrogen and tobacco use. All these can lead to mutagenicity and carcinogenicity reactions. There can also be a disease which are caused by drug, and we call them as iatrogenic or physician-induced disease. Or basically these can lead to functional disturbance if a drug is being prescribed by the doctor. Like your medicines, for example, here are hepatitis, which has been caused by rifampicin or isoniazid. Corticosteroids and salicylates, they can lead to formation of peptic ulcer. And chloroquine can lead to retinal damage. All these medicines, they can induce disease. So now comes the basic MCQs. I hope you will be able to provide us the answer at our YouTube channel. Which of the following drug is teratogenic in nature? The examples are warfarin, ampicillin, paracetamol, and adrenaline. Here, the best answer is warfarin. Question number 2 for you. ADR which are due to typical genetic makeup of person are known as side effect, secondary effect, iatrogenic if disorders or idiosyncratic disorders. Here the best possible answer is iatrogenic disorders. Next question. Withdrawal symptoms are common in which of the following? Caffeine, paracetamol, opioids and cocaine. Here the best answer is opioid. Next question for you. The most dangerous period regarding teratogenic effect is first trimester, second trimester, third trimester or early neonatal life. So here the best answer is your first trimester. Next question. International Collaborating Center of Pharmacovigilance is situated in USA, Australia, Sweden or United Kingdom. The best answer here is Sweden. So I hope you have gained a lot of clinical information through this presentation. Please like, share, subscribe our YouTube channel named as British Biomedicine Institute. Good luck, goodbye.